Joining me now, Dr. Mark Miller. Dr. Miller is the Chief of Family Practice here since 1989 at Norfolk General Hospital. Glad to have you with us.
Hi, I'm glad to be here too.
Now, there's actually another name for Dr. Miller, and that's the champ, is it not?
Yes, I'm the world heavyweight physician champ. I defeated Dr. Medvey easily in July.
Easily. And Dr. Medvey, of course, not here to defend himself, but that's okay. I certainly heard about the bout, and you made quite a name for both of yourselves in the community by doing that, and of course it was for a great cause as well.
That's right.
The hospital.
Well, the number one cause is me winning.
Yes.
But we did raise some money for the hospital, to the Nurses Education Fund.
Okay, and that's also why we're here today. Is so far today they've raised $82,651 for Norfolk General Hospital. And as a physician here, why is it important that we go above and beyond to ensure that we have the best level of technology for our patients?
Well, technology has really revolutionized healthcare. A lot of healthcare depends on information. As patients know, you go to the physician and the physician assesses you, and then we order tests and we have to communicate to other physicians. And until recently, a lot of that was done by paper. Now we have the ability to, with the technology, that we can have a turnaround time within 24 or 48 hours, which speeds up care, saves lives, it saves money. And that's what's great about this.
Well, that makes sense to me. If I've been examined by another one of your colleagues, it's no reason for you to have to do that again if you have that information available to you.
That's correct.
Okay, and that's really what it's all about. You know, for all of us living in Norfolk County, I've said it before and I'll say it again. It's not a matter of if you ever need to go to the hospital, but when you go to the hospital. And we want to ensure that that is the best possible scenario with the best possible outcome. And the best way to do that is to have the best technology, the best staff, the best everything at Norfolk General.
Yeah, I don't know if people have realized what's really happened in the last few years. A lot of the hospitals in our local region, Southern Ontario, have become interconnected with technology.
Okay.
So I work in Jarvis, but if a patient of mine is seen in Hamilton General or Norfolk General tonight, I usually will have that report in my office through the computer within 2 days. Whereas previously you'd have to wait 2 weeks for that by mail. We're not perfect, but we're constantly trying to improve this. And the goal is that we'll have like one database for the whole province, and no matter where you go in the province, people will be able to look up your test results.
And in a life or death situation, 2 days versus 2 weeks, that's huge.
Oh, it's major. You know, like when you're talking about things like infections, cancer, that type of stuff. Not even life and death. You're talking about people, like if you're training for a boxing match, you don't want to wait 2 weeks to find out if you're healthy or not,
That's
right?
True.
So it affects life in many different ways.
And you heard it from the champ himself, who, by the way, did win the boxing match against the other doctor, Dr. Medvey. I'm here with none other than Dr. Mark Miller, Chief of Family Practice here at Norfolk General Hospital. Dr. Miller, is there anything else that you feel the people of Norfolk County should be made aware of this afternoon?
Well, you know, I've been working here for 20 years, and I really think the people of this county are best in Canada. I took care of quite a few patients today, and patients here are just amazing. So when you're contributing, it's not just to the hospital, you're contributing to the people who live around you. So I think if you love Norfolk County, you'll support this hospital.
I think it couldn't be put any better than that.